You're an oral surgeon. What does an oral surgeon do?
An oral surgeon is a doctor who does predominantly surgery on the face, the mouth, and the most people know oral surgeons who pull wisdom teeth, treat facial fractures. In my case,
Okay, but you do much more than just pull wisdom teeth and maybe implant something. You're involved in an area that affects pediatrics in a great detail, cleft palate or lip. Is that true?
that's right. One of my major interests is children born with cleft lips and cleft palates.
First of all, what is a cleft?
A cleft lip is an opening in the lip, and a cleft palate is an opening in the palate, the roof of your mouth. Let me show you a picture. Let's see if we can focus in on this. Picture of a baby born with a one-sided cleft, known as a unilateral cleft lip, and it's an opening through the nose, the lip, the palate, and the bone that holds the teeth.
And what happened after all this surgery and correction? What it end up looking like?
Okay, if you look at the bottom picture, that's
Don't worry, give it.
that's a baby about 2 months after the surgery is done.
That's the same.
Same
before?
baby, before and after.
Do we know what causes cleft lips and palates?
That's a good question. There's sometimes we do know what causes it. The most obvious is there's family histories or family genetics.
So it does run in families.
Right, that have it. But and then there's problems that cause birth defects in general. Let's say a mother is sick during her first trimester with a bad virus, or takes certain medications.
Any particular medications in the choice?
There are two known ones that are, cause cleft lips. Number one, the first one that comes to mind is Dilantin for seizures. That has a high incidence of babies born with
So if
cleft
someone's
lip.
on that medicine, they want to get pregnant, they should have a discussion about the risk benefit.
Yeah, unfortunately, sometimes it's safer to take the medicine and take your chances. If you think about it, a cleft lip is easily repairable. The chances, what would happen if a mother had multiple seizures during pregnancy, they could cause more damage than just a cleft lip, which is a very treatable problem.
Well, sometimes they can use a different seizure medicine, maybe
Yeah.
less risk. What other medicine?
Well, the other really common one is not a medicine, but it's vitamin B deficiency. Now you wonder who would be vitamin B deficient, but it does happen, and not necessarily in people in urban areas like New York City, but in a worldwide setting, there's a lot of malnutrition.
So more likely in the third world,
Right.
very unlikely in the United
But
States.
as any doctor knows, practicing medicine today, even in New York City, we do see an element of people that are malnourished for whatever reason, and it's hard to explain why, but it does occur. But the majority of babies born with cleft lips or cleft palates are isolated events, and although we don't know why, you're going to see as the whole amount of research that's developing with the genes and chromosomes and mapping, you're going to see that we can pinpoint sort of a little bit more information as to what happened. I don't know that that's going to prevent it, but we're going to see a little bit more of an explanation as to saying this is a problem that's on a gene or a chromosome versus just we don't know why.
Okay.